Good afternoon, good morning, wherever you are. Thank you for joining us today. We're going to allow another minute for everyone to load onto our platform, and then we'll begin our webinar today. But thank you for being with us, and we'll be back with you in 1 minute. Okay, I think we're going to start now. I see that there are more people jumping on the platform, but we'll get started and make sure everyone is with us. Thank you for being with us today. Today's webinar is called Private LTE 5G Networks, the Future-Proofing Healthcare Solution for Secure and Reliable Networks. My guests today, Eric Abbott, who is an adjunct professor at Northwestern University, and Varun Vashisht from Amdocs. And I am going to be moderating with them today. I'm Rich Berliner from Connected Real Estate. And gents, thank you for being here today. It's really an important topic to the people I talk to on a daily basis. Healthcare is absolutely one of the most talked about parts of this ecosystem. And so I'm really pleased, Eric, to have you with us as an industry expert today, and Varun to talk about this from a vendor standpoint. So Varun, let's start with you. What is CBRS? I had an interesting, before we jump into this, I want to just make a couple of housekeeping notes. We will do what we can to answer your questions during the webinar. If not, we will answer them during the Q&A session at the end. If you want to ask a question, please use the GoToWebinar control panel to ask your question. Those questions will then be relayed to me, and I will ask them of our panelists. We are recording this session today, and we will publish a link to the recording within a few days. I would say 48 hours is about right. And if you want more information, you can go either to www.amdocs.com or connectedremag.com. And so without further ado, let's jump into our questions. Varun, what is CBRS and why is it such a hot topic right now?
That's a great question, actually. CBRS is a frequency band that has been used in the United States by certain incumbents and the US Navy. FCC came about 4 or 5 years ago to come up with a brand new innovative technology called shared spectrum to enable this frequency band to be able to be used by enterprises, anyone who wants to be able to deploy their own network.
Gotcha. So as it relates to healthcare, which is what we're really here to talk about today, healthcare has some very unique challenges in their networks related to quality of care, safety, security of patients, and all those things. Do you think anyone in healthcare at this point in time has any idea what CBRS and private LTE networks are and what they can use them for to improve their hospital or healthcare facility?
So I do believe healthcare professionals recognize the current challenges in their connectivity solutions. Industry in general is talking about two new things: the shared spectrum technology, where you and I could pay a small monthly fee to access the spectrum. And secondly, the best use of such a spectrum without spending billions of dollars, a private network, to have a highly secure, reliable coverage and capacity for connectivity needs. We are seeing CBRS-based private LTE networks starting to have many successful deployments, with Amdocs leading several of these. It is a solution that will definitely solve healthcare's primary and secondary use cases of offload, seamless connectivity in an efficient manner. But we need to be able to do a better job of educating the healthcare industry of availability and ease of deploying such a solution.
Gotcha. So Eric, Varun sounds strong on the fact that this is a great solution for healthcare providers and hospitals. But as I asked him, does anyone in the hospital or healthcare field know what private LTE using CBRS is all about? Do they know what it is?
Yeah, so it's a very good question, and it really depends on who the audience is. So like in any industry, there's a broad spectrum of different organizations, and where they are in terms of that journey with respect to wireless infrastructure really defines what they understand of CBRS, private LTE or not. I think some of the leading healthcare organizations and enterprises are aware of it, but they're not aware, I think, of the capabilities that it really truly enables at the system. So right now, it's primarily viewed as sort of a next step in the evolution of technology that can be deployed on a campus or inside a healthcare facility. The really good news is there's a lot of opportunity potential from a sales and growth perspective to really tell that story. And to bring along those healthcare organizations truly align with what the capabilities of this technology can really deliver.
So in real estate, I'm sorry, Varun, go ahead.
I wanted to ask a question. Eric, thank you. That is very helpful. So what do you think is the best way or a better way of engaging with such healthcare professionals on this new technology?
Yeah, I think the conversation really needs to be split into one of two paths primarily. The first is a technical discussion with those organizations at a healthcare enterprise that are focused on network infrastructure, so specifically healthcare IT or HIT. And typically that conversation would involve the chief technology officer or the senior leadership in those organizations. The second conversation is with the business leaders at the organization, more specifically what they call the business service lines. Typically, these roll up to an area president. So having those conversations about what this technology enables, both for patients as well as for their different clinicians and physicians, but it's less of a technical discussion and more of a use case discussion.
So, in real estate, we often talk about location, location, location. Sounds like, Eric, if I could paraphrase, education, education, education in this particular setting, because there's a long way to go to get them to where they really understand this. Is that?
Yeah,
sense?
Absolutely. It makes total sense. And I think I'll add one more. You're spot on about the education and the awareness, because I think even walk it back just a little bit is letting them understand what this is and what it means. I think that's a very important facet, and that ties back to what Rich just said about education. But the second part of this is how can this technology be used to support the different healthcare practices that they're trying to implement. So very much in the news today is virtual health, telehealth type capabilities. These two technologies, or we'll call it one umbrella of technology, really aligns very strongly with where healthcare enterprises really need to orient themselves.
Gotcha. And so are hospitals and healthcare facilities really good candidates for this? Does this dovetail nicely into what they need? And is it realistic to think that they would look at this and say, boy, this perfectly fits my need?
The answer is unequivocally yes, and I would say even more so an emphatic yes. And let me tell you why. Because a lot of the healthcare enterprises right now are really wrestling with cybersecurity issues as it relates to what we'll call as the traditional technologies of today. They understand that there's a scalability challenge that's coming with respect to some of the Internet of Medical Things that'll be forthcoming, as I mentioned. I think some of the other more practical, I'll say, opportunities are connected care initiatives. So looking at extending the reach of the healthcare organization, not only within the four walls, but on the campus environment and beyond. And even pragmatically, when you look at things like mobile edge computing, that again plays very well with this type of technology, being able to do point of care decision making. And by doing that with team-based care is something that's very, very important for future state healthcare operations. This technology clearly has those advantages given the high performance, the security benefits that it brings, and so on.
Got it. So Varun, I'm a sales and marketing guy by training. And so in that situation, it's always about questioning and finding out needs analysis and doing those sorts of things. So in your world, if you're going in to visit these folks to discuss with them sort of why this would be helpful, after you sort of quiz them on their needs, how do you go forward and explain the potential for this and kind of tie those, hey, you know, here's the problem I've got in my facility. And then you're looking at this and going, well, here's the benefits of what this will do, not focusing on the technical features, as Eric was saying, but more on the benefits side of this. How does that work in your world, and how do you see that?
That's a great question. I think the best way Amdocs can help is to offer our three-step approach. The most basic step, as Eric was mentioning earlier, is to engage the IT and business units and understand their connectivity needs. We would go a layer deeper and understand and segregate their primary and secondary use cases. Primary being the most critical challenges in the network today, like Wi-Fi offload, low coverage spots, seamless indoor and outdoor coverage for patients. CBRS-based wireless technologies are robust enough to solve the critical primary use cases today, and adding value with secondary use cases in the future, like remote and telehealth care, a seamless experience from when patients enter the facility, get treated, and go home to recover. This is the most important step to define the solution in terms of key metrics that need to be met. Hence, Amdocs Private LTE solution is customized based on exact current and future use cases that the hospital or healthcare facilities will need. There will be a head nod of sorts to start with certain use cases running on new CBRS network and others on older network, and they need to be able to work in tandem like a single network. And hence, the older IT network and the newer cellular network system integration becomes a key aspect. Our end-to-end solution offering does include radio and antenna equipment, the evolved packet core, our SaaS, which is the Spectrum administration services, powered by our software services of designing such a network, system integration of IT and network, and then managing this network with the network analytics platform. The benefits of such a cellular technology are all many folds. I mean, they pay for themselves in the years to come. As with the LTE and 5G, it offers the security and reliability that the facilities needs. And with CBRS band being the prime mid-band, offers both coverage and capacity as or when needed.
Got it. So you're sold on the features and benefits part of this, that we need to sell the sizzle, not the steak. So, yep. Eric, in your experience, what are the killer use cases that Varun would have the best shot at getting a hospital's attention based on what particular use cases you've seen and heard?
Yeah, let me start with. I'm going to get into these cases, but I actually want to take it up to sort of more the umbrella side, or I'll call it use cases. And let me start first with connected care, because I think that's probably the best one. Connected care can be subdivided into everything from remote patient monitoring to nurse communications to in situ telehealth services and so forth, which we saw during COVID-19, for instance, to sepsis management, to hand hygiene compliance. The next one would be patient experience, and patient experience could be subdivided into categories such as wayfinding, self-rooming. It could be activity monitoring, literally physical activity monitoring. Virtual physical therapy is a good example of that. It may even be something such as digital signage, so helping patients navigate where the facility is. The movement now is towards mobile signage, for instance, that has to be wirelessly connected. I think the last category is the operational efficiencies piece. And this is really, I think, one of the biggest areas of focus, given that a lot of healthcare enterprises right now have very, very laser attention on reducing costs. So location-based services becomes a very, very prominent aspect of this. So asset management is one of those key use cases. Where are people and things? I would say workflow efficiencies. So how efficiently are we moving patients through the system? That is a direct impact on patient experience, is a direct impact on costs. Can we get an extra 1 or 2 patients through? And it is literally a telecommunications use case that plays very well to the private LTE CBRS, particularly as we get within those 4 proverbial walls. I think the last one case is probably one of the most interesting, and this is the intersection of personalized medicine with mobile health capabilities in the form of deep data insights. So it's a bit of a buzzword, artificial intelligence and robotic process automation, but those are sort of an industry response to, what do we really understand about patients at the point of care who are scheduling and so forth, and then using the mobile technology to really understand and deliver that sort of seamless, sort of touchless high-tech experience is something that's very top of mind. The current wireless infrastructure technology stack, if you will, is just not capable of supporting those kind of compute-intensive platforms with the security and the privacy that's going to be necessary to do that.
Got it. So Varun, that's really daunting. You could go in and potentially see someone like Eric at a meeting, and he could give you a list like that of all of those things, and it would be very sincere because that's what the hospital really needs. Now you've got to go back and break that down and say, okay, what the hell do I propose, given he's got some very real interesting and well thought out needs? What do I do to solve that? Now, you mentioned this 3-step approach. How would you handle in dealing with this? Obviously, you've got the silos within the hospital, the HIT department, and you've got people like Eric, and you've got the president of the division. But how do you go about figuring out what to give him then from that?
I mean, definitely. Probably we can help folks visualize. Peter, if you can please bring up the graphic, maybe we can talk through the approach quickly. So our goal is to clearly understand the use cases and the service level agreement requirements as the first step. We then take those to build network requirements in terms of throughput, latency, coverage, and capacity metrics. Using our consultants and subject matter experts, work on a conversion chart of sorts from use case to technical requirements. This helps us recommend the best of the breed solution to support the network needs today and for the future. This private network could run non-critical use cases and help offload Wi-Fi, along with providing adequate coverage and capacity for patient monitoring, for example. If you see, this network could be designed for high availability and offers better security as shown on the graphic. It will also be highly resilient, low latency, and better efficiencies for IoT or Internet of Medical Things type use cases of growing number of devices and their medical sessions. Lastly, we help them build the network and end-to-end and operate it like they operate their current networks today. So in summary, the customized solution development for current and future use cases, understanding these requirements, and then building this network, designing such a network, and then helping it to operate as well.
So you really have to educate yourself on what goes on in these hospital and healthcare situations so you understand how to fulfill that need.
Yep, that's the key aspect.
So I could tell you firsthand, I had the unpleasant situation of having a short hospital stay not too long ago, and I had a piece of equipment that they put on me. I estimate to be worth $3,000 or $4,000 or $5,000 that got thrown in the corner for a couple of days while I was there, and no one had any idea where it was, what it was, and just kind of sat there collecting dust. So I could tell you that tracking of assets is certainly one that would be high on the list, because I bet you they lose plenty of equipment in most hospitals.
Definitely,
So,
and it's a typical IoT kind of a use case, and I think that will definitely can be operated with the right network layer.
got it. Interesting. So Eric, here's the $64,000 question. Do hospitals and healthcare facilities have the money to actually go out and install these systems, or are they basically looking at a situation where everybody who comes in the door they say no money, no money, no money?
Yeah, so the answer is yes, they do, but they may not directly have the money. Let me explain what I mean by that. So we're very fortunate that the FDA, Food Drug Administration, and the FCC have partnered for some time now, recognizing the need to really help solve what has become a broken mess in the country as it relates to our healthcare system. Towards this end, they have developed and are currently providing funding mechanisms to be able to drive some of these new technologies in healthcare. What's really important about it is they've taken a broad brushstroke perspective. So everything as it relates to, for instance, specific virtual health opportunities, disadvantaged areas, rural health particularly has been targeted for some of these funding grants. And healthcare systems are taking advantage of this. So it's been a tremendous opportunity for them to offset some of the traditional funding mechanisms. The second answer to your question is through financial donors. And this is something that has proved to, again, to be quite helpful in the industry. And the third one is, as part of the budgetary cycle, how do you prioritize some of these projects that come up? Inherently, because of the nature of deploying a network such as this, it actually follows a good sales cycle with respect to how those planning conversations are typically conducted. So if you look at it from, let's say, a 9 to 1 year sales cycle, if you will, getting that sweet spot of when to start those conversations and then driving towards a milestone-based approach to deploying the network is something that's going to fit well from a funding perspective of a healthcare system, whether it's for-profit or not for-profit.
Got it. So the money's sloshing around out there and can be had for the right situation, I guess, to paraphrase. Is that right?
Yeah, that's a fair assessment.
Got it. So Varun, in many ways, the way CBRS and Private LTE lays out is kind of perfect in that there's some money from some organizations and from some private donations potentially, but there's also a way to pay for this in a sort of a monthly payment plan, or a way to sort of use this this network in a way that's advantageous for these healthcare facilities. Can you tell us about that and how you'd propose these folks might be able to come up with the perfect solution to their financial need?
Definitely. I think the overall in terms of, just if we talk about technology, LTE technology, first of all, is not new. We have global operators deploying such networks for consumers. The CBRS band itself is best suited for hospitals and healthcare, as it provides coverage or capacity as needed. It is the prime band in a shared spectrum technology that can do this. Now, spectrum access itself is a very small component. What drives up the cost are the primary and secondary use cases, right? Which is basically a distinction between what are my critical use cases and needs today, and what is my wish list for future. All of these can be easily incorporated in this highly secure and reliable cellular technology. And we can help build a tailored total cost of ownership model for a realistic understanding of their investments, be it what is my upstart capital investment, what are my operations costs are going to be, is it there going to be a hybrid model, for example. So all these options come into picture as soon as we understand what we need to do in terms of the primary use cases and what we need to think about the future for secondary use cases.
Right, but what I'm thinking is the managed service approach here being an easy one to fit in when the organization might not have the ability to pay everything up front, but a managed solution gives them the opportunity to get what they need and pay it over a period of time with someone very efficiently managing the whole network. Talk a little about that.
Definitely, I think that is a very good approach as well to start something like this. The main costs will be there are kind of like hard costs and soft costs. Hard costs, which means you have to buy certain hardware equipment, deploy it, you have to manage your EPC core network. So all this can be incorporated in a model where you start with paying small monthly fees rather than paying a huge capital investment. So that could definitely be an option. that we
Got
could
it.
help with.
Yeah, that sounds like it dovetails nicely into what the marketplace is looking for.
Definitely.
Gotcha.
We can help with that.
So Eric, we kind of touched on this at the beginning, but give me some more background on this. That if Varun walks into a hospital and says, "We want to talk to you about a private LTE using CBRS network," do they go, "What are you talking about? I have no idea what this means," or are they already go, "You know, I've heard a little bit about that. I went to a virtual conference with Connected Real Estate, and they talked a little bit about that," but do they have sort of a good sense of how this could help them? Is there real recognition out there? Or are they basically kind of just listening to whatever consultant just left?
Yeah, I think the conversation with the technical team should focus on the technology itself. So they understand it, they get it, and they're going to want to talk, bits and bytes and so forth, and have that discussion. So, Varun touched upon latency and security and so forth. That's an appropriate type of discussion. It would not be an appropriate discussion though with the business leadership at a healthcare organization, the operational leads. For them, what you want to do is you want to talk about what the technology means, just like any other piece of technology. And really what you're trying to do is you're trying to find out what are their current pain points. So you have to do a bit of upfront research. And then what you have to do is demonstrate that by delivering this type of capability, you're able to, for example, perhaps have an additional 1 or 2 patients per day for a surgical procedure. Or you're able to locate, Rich, your example about that asset. You don't have a very expensive asset that has to be serviced, that's sitting somewhere unused, and so forth. You know exactly where it is, and then you can repurpose it so you don't have to procure another one and so forth. It's that kind of conversation that's going to get their attention, because that's how they're motivated and that's their interest. Right. Once you have that conversation, then you can bring in the how, which is the technology.
But is there any recognition right now that they have an idea of what this is all about? Do you think, what percentage of people from top to bottom do you think have heard of this?
I would say from a technical perspective, probably a solid majority. I would say from a non-technical audience, so the operational leadership at a healthcare enterprise, very, very, very few. We're talking probably single percentage. And the reason I say that is because they rely on their IT organizations to keep them apprised. But the second reason for that is they just don't stay focused on the technology per se. What they're looking to do is run a healthcare enterprise. They're focused on operational efficiencies, clinical performance, clinical effectiveness. Those types of things are top of mind for them.
So somebody selling to this group would have a better approach walking in saying, "How much equipment did you lose last year?" rather than, "Hey, I've got this new technology, frequency band way to go that it's going to revolutionize everything." They would want to say, "Wait a second, we lost a lot of gear. We don't know where it is. And boy, we'd love to be able to keep track of our equipment on a better basis."
Exactly. That's spot on.
Gotcha. So Varun, so one of the interesting things is, what role do service providers play in this whole ecosystem? How does that fit together with what you're doing, with what you want to sell them is the benefits of this, and what role do the service providers play?
So service providers and both infrastructure providers have a very bigger play with CBRS as an enabler for some of these use cases, and service provider acting as expansion to future use cases. Private networks have a lot of potential, and everyone has a key role to play, enabled by CBRS and expanded by service providers like roaming, and both running mission critical and bandwidth intensive connectivity needs.
Right, and I assume you want to throw in AI and things like that in the mix here too, that you're going to need a service provider, and it may not be an AI technology that you're comfortable bolting on here, but it may be that there's a service provider that could bring that AI to the table in this, correct?
Definitely. Yep, that is what will drive the future applications, to bring service providers into the mix.
Got it. So one of the things, Eric, that one of our benefactors has used the terminology that CBRS is the great gift that was given to us by the government. And so I guess the important thing is the multifaceted approach to going in this direction and figuring out, telling these hospital healthcare folks, these frequencies are things that are assets that carriers paid billions and billions of dollars for, yet you're going to get to use it for free, the frequency. Doesn't that play a big role? I mean, I would think that folks on the healthcare side would be awfully juiced by that.
Yeah, the answer is yes. I think, the minute they hear about cellular technologies and so forth, their minds naturally want to gravitate back towards, private near field wireless communication systems. That conversation needs to change, and it needs to change because the nature of healthcare operations is changing, where it better suits sort of the CBRS private LTE model, especially as it relates to that transition area between the campus, if you will, and inside the facility. And arguably even, I would say, as more and more, and this is from a cybersecurity standpoint, as more and more devices are added to their existing network infrastructure, or looking at the existing fabric of private near field communication systems, it's an opportunity to really bifurcate life critical operations from what we'll say is less critical type activities. So you look at, for instance, self-rooming as it relates to, for instance, a remote patient monitoring in a critical care area of the hospital. So that would be a good example. So it's really an opportunity to level the playing field as it relates to some of the past, I'll say, approaches to mobility in general inside a healthcare facility. So if I had to sum it up, I would say that it reduces friction for entry. And the near field technologies have really benefited from this for years. And so now there's a viable alternative, two viable alternatives, if you will, that provide some good permanence as it relates to them making those investments.
But it seems like if you're advising Varun on how to approach this, it would all be about education, features and benefits, talking about educating himself on the use cases and how a hospital runs and all those things. And so, from that standpoint, it seems like it's really, about the educational process here, so much so that, if you try to talk tech, I think you're going to blur over these people. It's got to be about, what this can do for you.
Exactly. And you have to show them the way. There's no other way of saying it. I think that's what you're saying is it's not even so much a leap of faith because the technology is proven and it's substantial. So I think it's really about look, these are the opportunities that you're not doing. It's more of almost the inverse that you can now do with this capability. And then I think translating that into an economic discussion becomes very attractive to a healthcare enterprise. And that's back to your earlier point that they don't have to invest in specific frequencies and so forth. And when they look at this at scale, then I think the argument becomes even easier for Varun and others to make.
Got it. So Varun, from that standpoint, you mentioned the service providers. And one of the things I didn't bring up at that point, though, is IoT. IoT seems like it's just absolutely going to be, part and parcel, very, very critical to these folks and how it all works. So can you talk us through how, the education process of talking through IoT, we talked a little bit about AI. How does that play in your mind?
So first of all, I mean, at Amdocs, we are focused on delivering the right network layer to hospitals and other healthcare facilities. All the use cases, both primary and secondary, the applications running on top, AI, critical applications, non-critical applications, operational efficiencies can be realized from the right network layer. CBRS band is the right spectrum to start with, and where it solves both capacity and coverage problems as needed. The benefits are to be able to provide coverage within facilities, connect to different facilities, both indoor and outdoor, how patients can securely stay in touch when they are back home after a procedure, for example, and to be able to add capacity as needed. I mean, what we saw last year with the pandemic, the capacity demands skyrocketed, and CBRS solves both challenges together. It is the right design of the network that will go a long way, and Amdocs can help do that. We take the discussion with both, as Eric was mentioning, the healthcare IT and the business units to understand both technical and budgetary requirements, and then be able to recommend the design, deploy, and operate of all the network components. We want to make sure, if we talk about IoT, the intent is to have a clear understanding of current challenges and forward-thinking use cases, both together, and then to be able to deploy the right network. This network can easily be expanded in terms of for coverage and capacity as more devices for IoT and AI-driven applications come in. The idea is to start with fixing current challenges, and then this network can easily be scaled. And we can help grow the benefits of this network by keep on adding new use cases as they come. This approach helps both the healthcare IT, the technical requirements units, and the business units of starting to fix current challenges and adding more value adds by controlling the budget more efficiently.
Yeah. Okay. I see that as a very important part of this, and we talked about the integration, the education, and then bringing others that you can bolt on that have different bits and pieces to this equation once you learn what the primary, secondary use cases are here. So the good news about this day, gentlemen, is that we've got hundreds and hundreds of people that are listening into what we're saying. Plus, we've gotten some fantastic questions that I can't wait to ask you. So I just want to finish up what we had on our agenda today and then launch it to the questions. Some of them we're going to, and what we're going to talk about right now with 5G, we'll answer some of the questions that came in. So one of the questions that came in, and I'll get back to our agenda. What is the time frame for private 5G networks, and over what spectrum would the private 5G networks operate? And so that leads me to, Varun, is 5G has been talked about by using the CBRS frequencies a lot. I'm not sure I understand how those will travel over. Obviously, it's a frequency band. You can use multiple different frequencies for this, but using 5G on a CBRS network, how does that shortcut me to getting 5G in my hospital, in my healthcare facility? Help me with that equation.
Yes, definitely. So CBRS, as you just said, is a frequency band, and it is technology agnostic. We are deploying older technologies like WiMAX today in CBRS, and also current technologies with LTE. 5G is here. It is coming. Core networks of today are 5G capable for CBRS band, and our partners are getting ready to bring 5G as early as this year. So if the industry has the right use cases of lower latency, ultra reliability, 5G will be available for CBRS. I mean, we are hoping by end of this year.
Okay, but how does having the CBRS network that we've talked about in my building help me to get 5G earlier than it might?
So 5G will be driven by mainly the use cases, right? So we will focus on the current challenges that can be fixed. LTE is here, so we can start deploying some of the use cases today. And then going forward, we can start deploying 5G as the industry starts to go towards 5G, which is the device ecosystem, the radio ecosystem, the core network ecosystem. So these are all coming in as we speak. So this year, we'll be able to go towards 5G. But we can start today with private network, getting all the benefits that we need and are needed today.
Got it. So Eric, this is a little bit out of left field question based on what I saw just now coming from the field, but do hospitals and healthcare facilities give a crap about 5G, and are they thinking about it? Are they talking about it? Is it because it's been advertised to death on TV? What's the thinking, about 5G?
Yeah, I think again, it's back to the sort of it's almost like a dual mindset at a healthcare enterprise. The technology departments actually do care. I mean, they should care because their charter is to make sure that they are enabling that healthcare organization to continue to move forward to support new methods of care. And so the answer there is yes. They care, they're aware of it, they're investing in, and I think it's something we talked about before. I think the business aspects of the organization, it's not so much that they don't care, it's just that they're interested in what type of technologies can I consume or utilize to make my job more effective. So if you let's say we're not even talking about 5G or CBRS, let's say we're talking just about AI, for instance. You know, they're not going to get super excited about AI. They're just going to want to know, what does that mean to me? So if when you have the conversation framed in that context, and you say, look, the way that you're doing, I'll use, for instance, nursing rounding is probably a good example of this. If I can show a better way to more efficiently use literally robotic systems, computer vision, so forth, with a 5G network, because it gives you that much better visibility, improve the quality of care, patient safety, they are going to care. They're absolutely going to care. And then their conversation is going to shift to back to the technology department to say, okay, I've heard this story. These are the things I can do. Great, it's 5G, it could be 20G, but I want it, and I want to know what it's going to cost and how can I get this going. That's how, again, where the passion lies.
Right. So I couldn't agree with you more. And it's funny, unplanned for this discussion today, I saw on television a demo of a handheld sonogram scanner kind of, I guess, sort of device. It was about the size of my TV clicker. And literally you could scan someone's body and it would show up on a phone. So you didn't have to go into the hospital, particularly if you were looking at, hey, I think I've got a kidney stone, or I think I've got some sort of lump below the skin, or I've got, this issue, that you could actually do a scan with this handheld thing and show it to the doctor on the spot. And I thought that was just perfect for the things we're talking about today, because the kind of detail you'd get on a 5G connection, certainly on a private LTE CBRS connection, would be very different than if you're trying to send it through your good old Wi-Fi connection at home.
Exactly, Rich. And I'm going to pile on top of that. I mean, there's new technologies coming out now. In fact, it's in the iPhone, whereas LiDAR technology that you can use with LED technology for spatial imaging that has a whole range of potential applications, clinical research, physical therapy, and so forth on down the line. So, now we're talking about exactly what's going to get those sort of clinical operational owners very interested in the technology. So it becomes less about, again, the terminology of what that network is, but what that network is delivering for the healthcare enterprise, which frankly is a business. And that's the way to look at this.
Got it. No, I agree with you. And, Varun, you've got your work cut out for you to understand all the things that these people could potentially bolt on to these networks. And Eric and I have been talking for quite a while about the Apple Watch being the epicenter of the universe for healthcare as we go forward. So anyway, we've got some terrific questions, which I'm going to jump into now. And I guess this one could be to both of you. Do you feel that the ecosystem is ready? If so, can you explain the total cost of ownership? That's how the enterprise will get their ROI. That's a tough one. I don't know if we can calculate ROI in terms of running this as a brand new way of doing things in the healthcare field. But why don't you take that on, Varun? Why don't you go first on that one? TCO and how it, how do you show ROI to a hospital?
Yep. So I think the ecosystem is definitely ready. I mean, the use cases that are coming that we are seeing, as Rich and Eric were talking about, people are already talking about the 6G use cases. But it is important to know that the network requirements are evolving, and it is the right time right now to start process of defining and specifically segregating primary and secondary use cases, because they will drive the total cost of ownership. So it is not that you deploy this network and you deploy another network for these different use cases. You just deploy this one network and you keep on adding more use cases as you need them. So the total cost of ownership will be very different if you want to get everything today in the ecosystem versus if you want to start something fixing your critical use cases that require attention today, like asset management, offload from Wi-Fi, or some of these things that we are talking about. So ecosystem is ready. Total cost of ownership will be driven by the use cases, and we recommend segregating use cases so we can start deploying some of these networks today, run the networks, older networks and newer network in tandem, and then manage the ROI that way.
Got it. So Eric, do you agree? Is the ecosystem ready? And when someone comes in and talks about this, the discussion of what's it going to cost me is got to be there. And Varun and I talk about this regularly, but we really haven't told people what is it going to cost. How do you view that equation? And is there a real discussion of ROI, or is it, look, you need this, and it's going to cost you more than you're going to spend?
Yeah, so let me take your first question on the ecosystem. The answer is absolutely yes. It's there. I mean, healthcare moves glacially. It's one of the big problems. And there's the big talk now is about digital transformation and innovation and so forth. And a lot of organizations are literally standing up those right structural processes to move forward. So the timing is great. With respect to your second question, I think the ROI piece is incredibly important, but the way to get at that is around benchmarking. And so the conversation then becomes, here's your current state, this is your future state, and then being able to show, and you could do it through a key performance indicator, service level agreement, however you want to do that commitment, but showing them this is what you're going to deliver. And so, having what they call an MVP, minimum viable product solutions approach to this, so you don't overcommit and underdeliver, is really a solid way. I mean, healthcare is conservative. It's conservative because by definition, you're dealing with life operations. They don't want to necessarily rock the boat too much. But the benefit of the CBRS Private LTE is that you're actually promoting better quality of care and timeliness of care and so on. And so as a result of that, if you take those benchmarks and you apply it to some of those challenge states and show that, look, maybe you have that intervention that's just a little bit sooner. Perhaps it's fall detection by way of example here. That actually translates into some meaningful impacts because healthcare systems, their payment process, it's now value-based care. It's not fee for service. So because of this, there's a economic incentive for them to want to invest in this type of technology. And it's literally playing to that to some regards. If you're having the conversation with the CFO, that's going to get his or her attention.
Got it. So, Varun, this is a really good question, and it's a technical question that I think I know some of the answer, but not the total answer. How will remote monitoring of patients be enabled by private networks? The patient would be in a remote location and on a public network. So, how does CBRS that I'm covering at the hospital now benefit me if I'm home and I've got my T-Mobile phone there? How am I helped by this internal private network if I'm on the public network?
So definitely, I think that's where service providers could play a really big role there. The intent for doing remote care, the way I understand is to be able to securely transmit data between the hospitals and the remote patients. So it becomes in a way where the service providers can play a role, that you create these private networks with the service providers that they can help transmit that data securely. So that's the way.
Right. So what you're saying is that just because there's a public network, the network at the hospital location has got to be secure because that public network already is secure. Yeah. So got it. Okay, that makes good sense. What is the time frame for private 5G networks, and over what spectrum? I think we answered that with the previous discussion. How will CBRS change the way PMI related data is segmented for HIPAA? I think that's an Eric question. How will
Yes.
CBRS relate to PMI data and how it is segmented for HIPAA?
Yeah, so I think they meant to say personal PHIs. I think what the intent of who wrote that question instead of medical health. The answer is in many ways. So one of the realizations is that, and it's some people find this surprising, but the number one industry for ransomware and cyber security attacks is healthcare. It's not finance, which most people might think. And with protected health information, as well as PII and PCI information, because it gets bundled together in a telehealth encounter as well, it's becoming more and more critical to have a very secure network. But it's not just the network itself. With these new, CBRS and Private LTE, you also have the ability to do auditing. And remediation if something's going on. And so why that is important is because at last count, and this is a very recent survey, about 70% of mobile health apps have one or more security vulnerabilities. They're just not architected with cybersecurity in mind. So to answer the gentleman's question, the PHI, protecting that PHI by doing it at a more supervisory level, if you will, where you can look for some of those data paths and so forth, becomes even more and more important. And this is actually something I talked about scale earlier. This is becoming an increasingly important conversation because healthcare systems are increasingly adopting apps, and they have a digital portal or a digital front door, if you will, or house, depending on what terminology you like. But they also have more and more wearables, more and more Internet of Things. And some of it isn't even necessarily healthcare related. So we've been talking mostly about clinical stuff. Some of it could be operational. So, think of building automation systems. Think about, other things that people bring into the healthcare system that aren't necessarily clinically oriented. You need to secure those down. They're still wireless. So, for these reasons, the question's about PHI, but even more importantly, it's really about cybersecurity and what are we doing to ensure that we're good.
Got it. So Varun, this is a good two-parter for you. Will the deployment of 5G into enterprise healthcare be stalled because of the need for a 4G voice anchor? So that's way over my pay grade. And are you expecting to see private LTE 5G networks running as neutral hosts, which sounds like it's sort of the next part of the other question. How and when can carriers be persuaded to onboard? And I have no idea if they can be persuaded, but take that one for the 4G. Is this going to hold up 5G that they need a 4G voice anchor?
So I think it's just about getting voice on these networks, right? So again, depending on the use cases that are coming in, there could be data intensive use cases that needs attention today. While we are trying to work towards a 5G or a 4G voice anchor or VoLTE types applications that can be deployed. So it should not stall anything because it's not just one single use case that is needed for this network. There will be multiple use cases that we need to be able to support. The intent is to start planning these out early on, and then we can give you an effective timeline on which use case to deploy when supporting this network. But the deployment itself does take some time. So after discussing the solutions, designing the network while we are deploying this, then we can take on the discussions on how to enable the 5G networks, but it should not be stalled.
Well, but this is your area of expertise, certainly not mine and Eric's, but my understanding is that you don't need 5G for voice. Voice doesn't do anything.
Sure. I mean, it can be on LTE too. Yep.
Right. So, I don't know that you need to run to 5G for voice technology. So, but then, the neutral host, the question was, are you expecting to see private LTE 5G networks running as neutral hosts? I'm not sure if there's a distinction between a neutral host and a managed service situation. So do you want to take that one on and look at a neutral host being run by certain kinds of companies and a managed service run by other kinds of companies? Is there a distinction?
I think they're tied together. A private 5G network in a multi-tenant building could be run as a neutral host. Definitely, that's an option. And that's a discussion for the real estate owner or the landlords who are folks are kind of like leasing the spaces, or even the folks that are trying to run these facilities. So that can definitely be an option. And managed services is after kind of like deploying all these networks. So one particular tenant could ask for certain management aspects, like let's say the radio and the core aspects. The other tenant could ask for even handling the tier one, taking calls for the first level of support for such a network. So that can definitely, both of these can work in tandem, and both of them are a viable option for such a deployment.
So I'm not sure which of you would be better for this one, but maybe we can go to both of you. Let's start with you, Varun. From a healthcare perspective, can you lay out the benefits of deploying a CBRS network versus upgrading to a full Wi-Fi 6 deployment? So that's a guy who's in the Wi-Fi 6 business. He's asking that one.
So I think it's not either or. It can never be either or. Wi-Fi is specifically technology that has proven robustness, and it is going to be here as the last mile connectivity. CBRS is mainly providing the benefits of high security, reliability with the LTE technology. And also CBRS itself does have certain propagation criteria that does go further than Wi-Fi. It adds capacity as you need it. It adds coverage as you need it. You deploy a cellular technology and you can connect a CPE device to enable Wi-Fi at the end. So it's not either or. It's again about the use cases, running some of the critical applications, some of the non-critical applications, and definitely a better design of such a headnet and working them in tandem would be in play.
Got it. Okay, so we've got about 3 minutes left. I'd like to do a quick wrap up. We have another question. I think it was for you, Eric. I'll send that on to you, and we'll give you the email address of this individual. It's a good question. But Eric, you want to wrap up first, and then we'll go to Varun?
Yeah, sure. I think, let me first by thanking my host here, Rich and Connected Real Estate, and Varun. It's Amdocs. Great conversation here. I think really as you look forward to the future of healthcare and so forth, it is increasingly virtual. It is increasingly on-demand driven, and it increasingly needs to be agile, which all plays exceptionally well to the ability to stand up very dense, high-performing network capabilities. And I think that core theme, if you will, is something that for those in the industry need to really recognize. Think of it as a new super highway, if you will, where healthcare is just an application. Call it healthcare as a service, if you will. So I just want to take that opportunity to thank everyone, and happy to take any questions offline. Thank you.
Varun?
Yes, so I echo it. I mean, this has been very helpful. Thank you, Eric, for enlightening us with all those new use cases that the healthcare industry is either discussing or thinking about. So this has been very helpful. In the end, what we understand is making the plan to discuss the technical aspects with the CT organization, the budgeting aspects with the business units, and understanding all these two and marrying these two, we'll be able to help the organization connect the dots. Amdocs is a one-stop shop for all your private network needs, be it the radio, antennas, the core, SaaS, managed services. So please feel free to reach out to me or our SMEs. We are available to help and transition and transform your networks. And thank you, Rich, for being a great host.
Thank you. And thanks to our sponsor today, Amdocs, for putting this all together and supporting us. And gentlemen, thank you so much. This was really, really interesting. And I hope the folks that were listening in got a lot out of it, because I certainly did. So thank you again. And anybody who wants to rewatch this will have a recording within 48 hours or so. And you're welcome to reach out to us for questions. Thank you, gentlemen.
Thank you.